their notes furiously because now they want to know what price is.
Okay, happy Friday, everyone. This is the April 17th briefing. Thanks for being with us. I tell you, with the elected officials and the city managers who have calls before this, we started out a different way, and I just wanted to kind of tell you what we did, because I thought it was pretty nice that everyone took time to reflect upon all the hard work and sacrifices of all those on the front line, all those in health, our doctors, our nurses, our EMTs, our paramedics, our first responders in police and fire, and certainly all those in the EOC has been working 6 weeks. And that's why we did it, because today the EOC has been open 6 weeks straight over all these weekends, and these dedicated men and women in our health DOC, Department Operations Center, and certainly back at the medical center have been working now for over 6 weeks in some cases, but marks the 6th week of a sustained effort here in the EOC. So we took time to stand up, all the elected officials, and applaud. And we had, it was very moving, a nice round of applause for all those who are on the front line. We're remembering them. We so appreciate them. They are the unsung heroes in this. A lot of them view it as just the job as usual, but it's not. We all know that because of the danger of catching this and in every interaction that you have with the public. But somebody's got to do those jobs, and the men and women throughout this county have stepped up and continue to step up to their moral obligation to make sure that they protect society. And never did they think, I would imagine, that they'd be in a situation like this, but they're still on the front lines and they're still doing it. And we just wanted to take a moment to appreciate them all and everyone here in the EOC and the DOC for all they have done and will continue to do through the duration of this crisis. So I just wanted to let you know about that. So today we have 797 cases, just short of 800 now. That's an increase of 50 from Wednesday. So we had an increase of 20 yesterday and 30 today. Sorry to report, and many of you know, we've had 7 more deaths, bringing the total to 28. As you continue to look at some of these slides, what strikes me is continuation of that age group between 30 and 50 that are really testing positive for COVID-19. And then if you look at the group that is most impacted by deaths, it's really 80 and over, which is something that we've talked about and feared, and that's why it's so important that we take care of our seniors in this community, and we make sure that they have shelter, and that we make sure that we are working with the residential care homes. We'll talk a little bit about that in a little bit more here. 71 currently hospitalized for COVID-19. We've got 82% the ventilators available, which is terrific, and 94% of the surge beds available, which is terrific. We still are using 65% of the ICU beds in the county. I'm happy to report, and I just want to take a moment and give Veerley all the credit. I had an opportunity to talk to their CEO this morning, and I just want to credit them for what the move they've made, and that is really to now avail the testing to those on the front line on demand. So no longer does those in health or in our first responders or those in a jail setting have to wait for symptoms. They even if they're asymptomatic, they will have the opportunity to go online right now and get tested within 24 hours. This is free of charge. This is something that we can do proactively now. So the police departments or fire personnel or those in the health field, and when I mean the health field, I'm talking about in clinics and hospitals and nursing homes and senior care facilities and other healthcare facilities, and those who work in any setting of incarcerated persons or those that are, ambulance workers or paramedics or law enforcement officers or firefighters will now be able to go through and get tested proactively instead of reactively, so that we can make sure that these folks who are, have a really an opportunity to be super spreaders if they have this and could be asymptomatic in spreading this, they will now have the opportunity to get tested to make sure that they are not carriers of COVID-19. So we just want to thank Verily for this. They have been terrific partners. Remember, they're doing this for free at great cost to their organization. They are the only drive-through free clinic in San Mateo County where anyone can avail themselves of their services. They are symptomatic, and we hope to, as soon as those tests become more widely available, we hope to make sure that, and they're amenable to it, certainly, to lower the standards for the general public to come through. But right now, there is not enough testing capability in the Schwabs to do that. But for those first responders, they will have the opportunity to engage in testing. So we're just very much appreciative of that. Parks, as a reminder, we will send out information, and we would ask you to reinforce for us that the parks, the county parks, are still all closed, and the beach parking lots remain closed. We want people, and we know people are getting antsy, but we've done such a great job. They need to continue to follow through here and shelter in place. Stay within 5 miles of your house if you're recreating. Do not go to the beach. Do not go to the county parks. Mid-Penn is closed again this weekend. The preserves at the Mid-Penn district are all closed for Saturday and Sunday. And we just want to make sure that people are diligent in following this. We know that it has worked in the past, and it continues to work, and it needs to continue to work in order for us to achieve our goals. A little bit about the senior care facilities. We're trying to get ahead of the spread of the virus in these facilities, which, as you can tell from the statistics I gave you, are something that we're greatly concerned about. And to that extent, to that end, we expect to visit 15 care facilities by Sunday to do assessments and get some limited swabbing in select facilities. So we have identified facilities that we want to work with. Again, because of the amount of folks in our senior living facilities and our SNF beds, we believe that it is essential to get out in front of this in those areas, and we have concern about all these facilities, but concern about some more than others. So we want to get out. We're showing people with our health folks out there and our paramedics in this county how to don and doff those PPEs and how important that is. The homeless population continues to be a great concern of ours. We believe by hopefully the end of today, we will be in contract with another hotel that will be able to house up to 80 of our homeless population, and these will be the most vulnerable of our homeless population. We will have some wraparound services for these folks at these facilities, and we hope to get them out of a more congregate type of setting and into individualized rooms for health reasons. So we look forward to doing that next week. And we will certainly keep you apprised of our ability to do that and the ability to get our seniors or our homeless people, especially our senior homeless people, off the street. I mean, our highest concern there is really those that are 65 and over who are homeless, who have underlying medical conditions, and others in our system who have medical conditions that we know will need some more help. Let me go to some of your questions here. The first question is, we seem to be having big jumps in the death numbers all at once. Is there an issue with reporting, or are there just cases happening all at once on one day? And it really is a matter of reporting. And we want to make sure that our numbers align with the state's numbers. And that's where you see time that it takes to do this. So we on Wednesday and Friday nights are really trying to report out on these type of situations after we've aligned with the state, so we make sure that we're not mixing up the numbers and giving false numbers on this. It's important that we double check and triple check these numbers. So it's just a matter of the functioning of the reporting system that it's in. It's not that these cases are all happening all at once, overnight, but it's really making sure that we work it through the system and that all the numbers align. How is it determined if it is a COVID-related death? Does a coroner make that determination? The coroner makes the final determination in all these deaths. And certainly they look at the patient's medical history in making that determination, including if he or she was positive for COVID-19. So if the person was positive for COVID-19 and they died, that is an assumption that they died because of the disease. Earlier in the week, it was announced that there would be more attention given to nursing homes. Can you tell us if there is specific concerns in the county right now? And as one of them, Redwood City. And the answer to that is yes, there are specific concerns about that right now. We will be sending out a press release this afternoon talking about the Redwood City facility, which has been broadly reported as Gordon Manor Residential Care Facility. It's the name and situation has already been out there, but San Mateo County Health is currently providing round-the-clock support for that facility. We're also in the process of requesting the staff from the state to augment our current support at the facility. But moreover, there's several places in the county that we're concerned about. We've got 15 places that we're looking at, and we're deploying response teams to those facilities across the county to do the assessment and to test residents and staff if necessary. As far as Gordon Manor, everyone there is being tested. So that press release will be sent out by Michelle Duran later today. I will follow up on that next week as we make that, if we have further information on that. And then has testing increased at the event center? It has not. And if not, the theories are the same, that it's really because of the two requirements that are necessary, and that two underlying requirements that are necessary. And we believe as more test kits come available that they'll decrease that, or they'll go to serological testing in the future, which would be more of the masses, but they've got to get those test kits available. Now, certainly there seems to be enough for the first responders and those in health, so that is where a lot of the resources will go immediately, because of those folks who are out in the community in these essential services jobs, really interacting with a large scale of the community in their daily jobs. So with that, I'll see if there's any questions.
There are no questions right now.
Great. No questions?
Oh, we got one from Henrietta. You've been unmuted.
Yes, thank you. When the county has approached the hotels to house the homeless, have you run into any pushback? Are there special conditions? Are they housed in special areas of the hotel? Can they intermingle with other hotel guests if there are any?
Well, two things. So one is that the first one, to your point, I got to tell you that hotels have really stepped up. I mean, not all of them, but there's a lot of them that have offered their services, and they've been very good about that. I mean, surprisingly good about it. So we certainly appreciate that cooperation, and we try to find hotels where we could, take over the whole hotel if necessary, because we're bringing in services but we are only paying for rooms that we're using, and we think that's responsible. And there is services there, that remain at the hotel, housekeeping and different services. So, and we're getting it, at a good rate. And I think a lot of folks feel that there are assets out there that they may own, and they want to try to help out also, and they understand the need and the desire. So they have stepped forward. Whether it's we take over the whole hotel or a portion thereof, and there's other guests there. A lot of these places don't have many people because travel is being limited and people are on vacation and those type of things. But either way, social distancing and all those things are still in effect. So you don't see people mingling. We're not going to encourage people to mingle. The whole point of this, to a large extent, these are people who are vulnerable and who have underlying medical conditions, and we want to somewhat, isolate. Not saying they certainly can't come out and get fresh air or walk around on their own or go for a walk within that 5-mile radius, but for the most part, we want to make sure that they're taken care of, and that's why we'll have medical staff there and wraparound services there for these folks. But we wouldn't encourage them to mingle, and we provide food for them also. And the nice byproduct of this, I guess, if there is one, is that we do try to buy from the local community, from the restaurants, to supply food to these folks, and they get three meals a day, as they would in a shelter setting. So we try to buy locally, and those restaurants have really stepped up and helped us out, and hopefully we're able to keep them operational and keep some people employed. So that is a positive byproduct of moving these into some of these cities and utilizing the space that they have available.
Have most of them been cooperative, most of the homeless, when it comes to allowing themselves to be housed in the hotel?
Yeah, most of them have. I mean, that we're seeing, especially the ones that, we're taking several of them out of the existing shelter because the congregate living there is not ideal for their underlying issues, and the fact that they might be over 65 and more susceptible to COVID-19. So they're moving out to a more private, more isolated setting, and they've been certainly amenable to that. Some of the encampments we've seen, don't want to be broken up and moved out, but the CDC advises us not to do that. We don't want to break those up and spread those people all over the place. We would prefer if they're doing that, and we don't encourage that. We encourage them to come inside, but we have no way to force that upon them. And we certainly don't want to go in and break these encampments up and send people all over the place, only to potentially infect others in other encampments. But to the extent they want to, our goal is to make space for everyone who wants space and who needs space. And we're well on our way to doing that with the space we've created in the shelter, with our other 100 folks that have been housed in hotels, and along with this current staffing. So we will have everyone off the wait list once we get this hotel under contract, and everyone who wants a place will have a place.
One quick follow-up, are they tested?
They're not. No, they're not. That's not a requirement for them to be coming into this setting. But certainly, if they had symptoms, they would be referred to the health system to get examined and potentially tested. But they do not. And I just want to remind you that we do have that. If they, like anyone else, met that criteria, we could transport them down to Bearley to at the event center to get tested. So they have the ability to go online and get tested, and to the extent possible in the setting that they're in, to get tested, or through the health system for that matter to get tested.
Thank you.
Thank you.
All right, we have a related question from Emily here asking, are the hotels where emergency workers are staying separate from the hotels that are being used for the county's homeless folks?
Yes, that is correct. So we have hotel rooms for emergency services workers And we've got hotel rooms throughout the county, you know, from North County to South County, that really provide different functions for us. Some are for, you know, COVID-19 positive patients, some are for homeless, some are for medical teams that we brought in from the outside, some are for first responders who are working long hours and can't drive home. So we've got a variety of hotel rooms that we're utilizing throughout the county.
Emily also is wondering if any of the 15 senior homes are the ones designated by the state to take folks.
So let me turn to health for that to take.
Ask the question again.
Wondering if any of the 15 senior homes are the ones designated by the state to take folks. And maybe Emily, if you have a little bit more information to give us there to that question.
She can't talk.
I'm going to go ahead and mute you.
Yeah, can you hear me?
Yeah, Emily, thanks.
Yeah, thanks, Mike. It's my understanding that some senior homes, I've heard about this mostly in San Francisco, are supposed to be taking some of the older folks, I think, out of hospitals and treat them at the senior care facilities. So I'm wondering if that's an issue that the county has to deal with at all.
No.
Not that you're aware of.
No, we're not doing it in this county.
Cool. Okay. Thank you.
No, we've got you know, for those who are positive, we do have places. We have those step down facilities that we're utilizing, and in Burlingame, I think we have 133 rooms still available, and I think we're only using 3 or 4 of them right now. So you know, even those, I think we're up to 18 at one point in time. Even those have diminished, but it's been a great resource for us. And again, that was I think we were one of the first or the first in the state to do something like that, and it's really worked out for us. And if we had to use it as a regional resource, we'd certainly be amenable to that too.
Great. Thank you.
All right, John asked in the chat, what specific help are you getting from the state at Gordon Manor?
Yeah, I'm not sure of any help right now. Peter, are you?
We're because they're a licensed facility. We're coordinating with them. Our CD control team is working with the state to have them be aware of the situation. Again, Mr. Callagy said it really well the other time. It's not our responsibility, but San Mateo County is responding. So we're stepping in to help.
Yeah, I mean, this was a really humanitarian effort. They needed medical personnel to step in. There was not available anywhere else. We took some of our medical personnel that we brought in on the ground here, and we deployed them to that facility to really help out. It was at a critical stage. So, you know, they've been very good about working with us at Gordon Manor, and you know, we look forward to the day where they get their staffing back up and they're trained and they're able to handle the situation on their own. But you know, it's tough. I mean, in all these places, I don't think any one of these places really expected to ever face something like this, and this is so unusual. You give them credit for, you know, those folks showing up every day and taking care of some of our most vulnerable populations.
That's all our questions.
Okay, listen, everyone, have a fantastic weekend, and we will see you back next week. Stay healthy.